All remaining parts of the cranium have no cartilage. A membrane is directly substituted, superseded by bone. So here you can see separate cranial bones. The cranium can be separated into two parts. The first one just refers to the neurocranium because inside it houses the encephalon, brain. This part is positioned superiorly and posteriorly. And the second part of the skull refers to the viscerocranium or splanchnoscranium. So here, apart from this, the neurocranium is further separated into two parts. A very difficult cranial base and a very easy calvaria or fornix or roof. The cranial roof is composed of squamine, like fish plates. We can say squama or squamous part. So all bones in the calvarium roof look like squamine. In front is the frontal squama. Behind, in blue, is the occipital squama. And between the occipital squama and frontal squama, on both sides, we have two parietal bones. Two parietal bones look like parietal squamine. And the internal cranial base includes the occipital bone starting with, so except for the superior part of squama. The superior part of occipital squama is involved in the roof. The remaining bigger part is involved in the cranial base. In front of the occipital bone on the base is this sphenoid bone. The sphenoid bone is very difficult because it forms a very center. It has 7 parts, 1 body and 3 pairs of processes. These processes are lesser wings, greater wing, and pterygoid processes. Pterygoid processes. In front of the sphenoid bone is the ethmoid. The ethmoid is involved in the lateral wall, in the lateral and medial walls of the nasal cavity. And just here on both sides, we have a very difficult bone, the temporal bone, that has 4 parts. The superior part is called the temporal squama that contributes to the Calvarian roof. The second part is the mastoid part. In front of it is the tympanic part, which is marked by the external acoustic meatus. It is to do with hearing. And the most difficult part of the temporal bone builds its base. So it's invisible here. It's involved in the cranial base. The biggest bone referring to the viscerocranium is the mandible. The mandible, in the fetus, we have 2 mandibles that fuse to form 1 mandible. Contrariwise, the maxilla is a paired bone. So we have 2 maxillae or maxillary bones and 1 mandible. The biggest bone in the splanchno or viscerocranium is the mandible, and the second one is the maxillary bone. The maxillary bone articulates on both sides with the zygomatic bone. The zygomatic bone is a very important bone from a functional point of view because it transmits forces exerted during mandibular movements and mastication, and such forces are transmitted through 2 processes of the zygomatic bone. One process passes upwards to the frontal bone, so it must be called the frontal process, and the other faces and joins the temporal bone, so it must be the temporal process. Due to both frontal and temporal processes, all masticatory forces are transmitted to the neurocranium. Apart from this, we can see some small bones like nasal bones, lacrimal bones that will be visible while viewing anteriorly. As you know, the cranial base develops in an endochondral manner on the base of cartilage. The remaining part, including the calvaria and the viscerocranium, are ossified without any cartilage. So this is an intramembranous ossification. The only exception to this is the ethmoid and inferior nasal concha. These bones these bones ossify on the base of cartilage. So we have 2 exceptions in the viscerocranium, that ossify on the base of cartilage, and no exemptions in the calvaria. Just in the newborn, we can see some membranous things on the calvarian roof that are called fontanelles or fonticuli. Fontanelles or fonticuli. There are 2 unpaired and 2 paired fontanelles in the cranium. The biggest one is the anterior fonticulus. That's rhomboidal. And posteriorly is the posterior fontanelle, posterior or occipital, anterior or frontal. On the lateral aspect, we can see a rather big mastoid fontanelle that's irregular, and a very small sphenoid fontanelle. And after birth, these fontanelles ossify. So membranes are mesenchymal membranes are substituted with bone. This appears just 3 months after birth, referring to the smallest fontanelles. So which fontanelles are smallest? The posterior and the sphenoid fontanelle. Posterior is occipital and this is sphenoidal. So posterior, occipital and sphenoidal fontanelles are closed by month 4. The next one is just an intermediate fontanelle, is the mastoid one. So it closes by month 12. And the biggest fontanelles, the anterior, the frontal one, is closed just between year 1 and 2. In order to understand the structure of the skull, at the very beginning, we should be familiar with its exterior. So from above, anteriorly, posteriorly, laterally, and finally the inferior aspect. The inferior aspect is the most difficult, and the superior aspect that's visible here is easiest. So just this is the superior aspect of the skull, or just the calvarian roof. It's ovoid in shape. So, and it's wider behind than in front. Just here in front, we have 2 frontal tubers, and posteriorly a much wider is transverse distance between two parietal tubers. So how many tubers can we distinguish in the calvaria? Just 4. 2 frontal tubers and 2 parietal tubers. Both frontal and parietal tubers are much more conspicuous in children and women. All remaining things are much more accentuated in men. On the superior aspect, we can see in front the frontal squama. The frontal squama is convex on its exterior surface and concave internally. And behind it, we can see 2 parietal bones. And the very posterior part is occupied by the occipital bone, its squama, precisely the superior part of squama, which is involved in the calvaria. The remaining part of the occipital bone, including its inferior squama, 2 lateral parts, and basilar part, are involved in the internal cranial base. In the skull, we have only 2 synovial joints, the temporomandibular joints. Apart from this, all remaining joints are fibrous. A specific kind of syndesmosis that refers only to the skull is called suture. So sutures are typical of the skull alone. Just as you can see, all the sutures are dentate in shape. So borders are dentate and acute and just interdigitate. Such a suture is called a dentate suture. So in front is visible the coronal suture. The coronal suture is between the frontal squama and 2 parietal bones. Just 2 parietal bones are joined by the sagittal suture, because the sagittal suture is extremely dentate. We can find here even separate, small separate bones, the so-called Wormian bones. And just here is visible a separate parietal bone. This is the left one. This is its anterior border that articulates with the frontal squama. The superior border articulating with its partner, contralateral partner. The posterior border that articulates with the occipital bone, and the inferior border articulating with the temporal squama. Apart from this, because the parietal bone is quadrilateral, so it has 4 angles. The anterior superior angle is frontal. The anterior inferior angle is sphenoidal. The posterior superior angle is occipital, and the inferior posterior angle is mastoid. The names refers to its osseous neighbors. This is the sphenoidal angle because it joins the greater wing of the sphenoid bone. On the exterior, we can see just 2 lines that arch below the middle half of the parietal bone. The superior temporal line and the inferior temporal line. As you can see, the inferior border of the parietal bone is beveled externally. So this means that the other bone, the other articulating bone, that is the temporal squama, must be beveled internally and just overlaps the parietal bone. And here is the interior of the parietal bone. Such trees are caused by arteries, meningeal arteries. This is sulcus of middle meningeal artery, and here just passes in parallel sulcus for posterior branch of the middle meningeal artery. So the anterior branch of the middle meningeal artery directly projects on the sphenoidal angle of the parietal bone. Such a place is extremely frangible, so brittle, and may easily be fractured, broken. And at the same time, the artery is ruptured. And as a result, we have a hematoma, epidural hematoma, which is life-threatening and requires surgery. So such a place here is extremely brittle. Just such a point here that projects on this groove, arterial grooves, has a special name, pterion, PT, pterion, or Sylvian point. And here is the anterior aspect of the skull. Some superior 2/5 are responsible for the forehead. The next 2/5 refer to the middle part of the anterior aspect, which is very difficult because it has 3 big openings. The middle opening refers to the nasal cavity, In fact, we have two nasal cavities, right and left, separated from each other by the osseous nasal septum. Such a foramen is called the piriform foramen, so pear-shaped foramen. It's flanked by two orbits that start in front with their orbital openings. As you can see, the superior supraorbital border is built by the frontal bone. Just here, while viewing anteriorly, we can see three parts of the frontal bone. Its squama, its two orbital parts, and just between both, we have its nasal. This is just the front of the nasal part. The remaining nasal part passes just transversely, passes backwards, and it looks like a horseshoe that's closed in front. So nasal part, the supraorbital margin is just here. You can see that the supraorbital margin is notched, or sometimes we have foramen, supraorbital foramen or supraorbital notch. It separates the supraorbital margin into two parts, the lateral 2/3 with its rounded border and the medial 1/3 with its sharp, acute border. Lateral 2/3 and medial 1/3. And between both is either supraorbital notch or foramen. Somewhat above supraorbital margins, we can see small that are called superciliary arches. Superciliary arches. Between the two superciliary arches pass towards approximate, but are still separated from each other by a flatness between them. Such a flatness is called glabella. Glabella is a small flat area between two superciliary arches. Apart from this, the very center of the glabella, which is an area, is just a craniometric point that's called the same glabella. So the glabella refers to two things, area and point. Somewhat superior to the glabella is a point that's called ophrion. Ophrion. The ophrion is just in the middle on the line joining the uppermost points of two superciliary arches. So the transverse line joining the uppermost points of two superciliary arches. Somewhat here is ophryon. Somewhat lower is glabella. Apart from this, just between two frontal tubers in the middle is the metopion. Metopos in Greek means forehead. So metopion is here. So which craniometric points refer to the frontal squama? The uppermost here is metopion, ophryon, and glabella. The supraorbital border medially joins the nasal bone, which is a very small quadrangular bone, and the frontal process of maxilla. Frontal process of maxilla. On the lateral side, it's continuous with the zygomatic process. The zygomatic process of frontal bone articulates with the frontal process of the zygomatic bone. So here we have two reciprocal processes that form the lateral boundary of the orbital opening. Just here, at the place at which the internasal suture joins the frontonasal suture, so at the place where the frontal and two nasal bones meet is another craniometric point that's called nasion. Nasion. The middle 2/5 of the face are mostly composed of the two maxillary bones. The maxillary bone has four parts. Such a part here that's somewhat depressed, concave, it's called a body, maxillary body. It has three surfaces: anterior, nasal, and infratemporal or posterior. So anterior, medial or nasal, posterior or infratemporal. Such a concavity here on its anterior aspect is called the canine fossa, which is perforated by the infraorbital foramen. The maxillary body sends four processes, three of which are visible in front. Frontal process joins the frontal bone and mostly bounds the piriform aperture. So the piriform aperture is mostly bounded by the maxilla and superiorly by inferior borders of two nasal bones. Another process joins the zygomatic body, so it's called zygomatic process. And the inferior one, alveolar process. Alveoli are conspicuous here due to their alveolar juga. Alveolar juga. In front, we can see that in front, just at the inferior boundary of the piriform aperture in the middle, is the anterior nasal spine. Anterior nasal spine. Its top refers to the acanthion, another craniometric point, acanthion, but its superior point is just here, refers to the rhinion. Rhinion is to do with olfaction. Rhinion in Greek means olfaction. More, we can see the zygomatic bones with their bodies and two processes, frontal and temporal process. And the inferior 1/5 of the face is composed of the mandible. In the embryo and fetus, we have two mandibles that fuse afterwards. So finally, we have one mandible. The body of mandible rami, mandibular rami. While viewing anteriorly, we can see three openings that are positioned on the same vertical line. So supraorbital foramen, infraorbital foramen, the biggest of the three, and the mental foramen, through which exit three branches of the trigeminal nerve. So such 3 points are extremely important for the trigeminal nerve. And here is a separate frontal bone while viewing anteriorly. So its biggest part is a squamous part. Its exterior is convex. Apart from this, we can see two orbital parts that contribute to the orbital roof. Two orbital parts are triangular in shape and concave. Just laterally is a depression that houses the lacrimal gland. It's called fossa or lacrimal gland. Contrariwise, medially, we can have either a spine or a fovea, trochlear spine, or in some individuals we have a spine, and in other just a fovea, trochlear fovea. And just between two orbital parts here, in orange is visible the ethmoid bone. So just such a horseshoe in gray refers to the nasal part of the frontal bone. It's positioned in the transverse axial plane. So it's closed in front and opened behind. Its underside is rough because it has numerous semicells that complete reciprocal semicells of the ethmoidal labyrinth. At the place at which 4 parts of the frontal bone meet, inside are 2 frontal, so pneumatic spaces covered with mucosa. They belong to the paranasal sinuses. Just here on the right, we can see the supraorbital foramen and medially frontal notch. And on the left, no foramen on the left, only 2 notches. The more lateral is the suprafrontal notch, and the more medial is the frontal notch. And here, fossa for lacrimal gland and either trochlear fovea or trochlear spine with no difference. This was discussed, and maybe maxillary bone, zygomatic bone, maybe some very simple things concerning the maxilla. So the maxilla has 5 parts. Its body with 3 surfaces: anterior, medial or nasal, and posterior or infratemporal. The maxilla is a pneumatic bone with an air space, the maxillary sinus, and its maxillary sinus may enter the zygomatic process. It may completely invade the maxillary process, the zygomatic process. And here is the zygomatic bone. The zygomatic bone, as you can see, it's a quadrangular bone. But what's typical of it? In spite of being quadrilateral, it has as much as 5 borders. So these borders are visible here. So this is superior anterior border, inferior anterior border, then superior posterior border, and inferior posterior border. Apart from this, the most important for topography is the medio-posterior border. That's visible in the orbit and in the temporal fossa. So in spite of being quadrilateral, the zygomatic bone has 5 borders. this is the fifth border. And some things concerning a genuine skull. So just in the embryo and fetus, the frontal bone is double. So two frontal bones are separated by the frontal suture or metopic suture. Metopic is even better than frontal suture. And its remnant is visible in most skulls only inferiorly. So the metopic suture is visible in most skulls inferiorly, but in some 7% of adult people, it's complete. So the frontal suture is complete in some 7% of population. Here we can see the canine fossa with the infraorbital foramen, alveolar process of the zygomatic bone with its alveolar juga, canine fossa infraorbital foramen, and 5 zygomatic bone with its frontal process. The posterior one temporal is invisible, and the fifth border is here, posterior medial border. As you can see in the mandible, just in the midline in front, we can see a mental protuberance. A mental protuberance that's triangular with its superior apex and its inferior base. That's bounded laterally by the mental tubercles. Mental tubercles. This is the ramus of mandible that's continuous with its body. This is the mandibular body that's continuous with its ramus. And the anterior border of the ramus is continuous with the oblique line. The oblique line just passes below the mental foramen and ends in the mental tubercle. So the oblique line is very long. The norma occipitalis means posterior aspect of the skull. So it's composed, the very center is composed of the occipital squama. What's the precise meaning of occipital? Occipital referring to the west, not to the east, but to the west. Occipital. There is a very popular Latin sentence that says that light comes from east and right as the law comes from occipit, so from west. Just in the middle of the occipital squama is the external occipital protuberance. On its top is a special craniometric point that's called inion. Inion. Inion in Greek means posterior. Inion. Just apart from this, from the external occipital protuberance descends towards the foramen magnum the external occipital crest. Just in the middle, the external occipital crest sends two inferior nuchal lines for nuchal musculature, and the external occipital protuberance gives us two pairs of nuchal lines, more conspicuous superior nuchal lines and less conspicuous and or sometimes absent supreme nuchal lines. Supreme means uppermost. Apart from this, here on both sides of the inferior part, so just here you can see that the occipital squama has two distinct parts. Its superior part refers to the cranial root, and the remaining part, the inferior part, refers to the cranial base. Sometimes the superior part, which ossifies by intramembranous ossification, is a separate bone, and it's called then Goethe's bone because it was typical of a poet Goethe, German poet Goethe, or interparietal bone, because in fact it's triangular in shape and is limited on both sides by two parietal bones. So between two parietal bones may be the interparietal bone. Such a suture between the occipital bone and two parietal bones is called the lambdoid suture. Lambdoid suture. With the lambdoid suture are to do three craniometric points. So on both sides we have asterion. Asterion like a star, asterion. So two endings of the lambdoid suture are called asterions, and at the place where the lambdoid suture meets the sagittal suture is just lambda, craniometric point lambda. The sagittal suture is limited behind by the lambda and in front by the bregma. The bregma is just the place where the sagittal suture meets the frontal suture. And here is visible the posterior aspect of the mandible and the posterior aspect of the two alveolar processes of maxilla. Just here you can see interparietal bone or Gette's bone. And the lambdoid suture is the most dentate suture in the skull. Because of this, here we have numerous separate Wormian bones, sutural bones, or Wormian bones. And just here we can see the external occipital protuberance with its inion and external occipital crest, giving us and from occipital protuberance start conspicuous superior lines, less conspicuous and supreme nuchal lines. Just here you can see that the parietal bone is jutted by a parietal foramen. Parietal foramen. The parietal foramen obelion is here. On the line joining two parietal foramina that cross the sagittal suture. On the norma verticalis, so we have the coronal suture, lambdoid suture, and sagittal suture. Such a point here in front is called bregma, and behind is called lambda. The lateral aspect or norma lateralis, posterior part of the skull is composed of the neurocranium, and the anterior inferior part suspended from the neurocranium is the viscerocranium. The very central aspect is limited by the superior temporal line, and such a plane is called the temporal plane. In fact, in front, it starts with the posterior border of the zygomatic process of frontal bone, then forms a crest that's called the temporal line. The temporal line soon divides into two lines. In front, the superior temporal line is conspicuous but fades away in the posterior direction, so it's invisible here. Contrariwise, the inferior temporal line is very small here, but it becomes bigger and bigger. It arches forwards and forms the supramastoid crest. Supramastoid crest is an osseous ridge just above the masted process, and afterwards it's continuous with the zygomatic process of the temporal bone. In fact, such a place here is called the posterior root of zygomatic process, because the anterior root of the zygomatic process is in front of the mandible. It's called the articular tubercle. And the zygomatic process of temporal bone joins the reciprocal temporal process of the zygomatic bone. As a result is the formation of the zygomatic arch. The zygomatic arch bridges two bones, temporal and zygomatic, on the lateral aspect of the skull. So we can just enter deep to it. So between the temporal squama and the zygomatic arch is just a space. Due to this space, the temporal fossa joins the infratemporal fossa, that's lower and medial to the mandible. Just here, in the temporal fossa or the temporal plane is the medial wall temporal fossa that's limited by the superior temporal line. To the superior temporal line, insert is attached the temporal fascia, and to the inferior temporal line is attached the temporalis muscle. The temporal plane is composed of 4 bones: the temporal squama, the greater wing of sphenoid, the temporal surface of frontal squama, and the inferior part of the parietal bone. We have here 4 bones and just a very conspicuous suture that resembles H letter. Just here, H capital letter. Just its transverse part refers to the sphenoparietal suture. The sphenoid is the very central bone, so all sutures with the participation of the sphenoid bone start with spheno. So frontal, sphenozygomatic, instead of parieto-sphenoidal. Parieto-sphenoidal is incorrect. Sphenoparietal. And just here, where is the sphenoidal angle of the parietal bone is a very important place, because such an area is very brittle, fragile, and deep to it passes the anterior branch of middle meningeal artery. Such a point is called pterion, just the very middle of the sphenoparietal suture is pterion or Sylvian point. The Sylvian point is just in the middle between the sphenion and crotaphion. Crotaphion means temple, like temporal bone, temple. And so we can say that the sphenoparietal suture starts in front with the sphenion, craniometric point sphenion, and ends in the crotaphion. And the pterion is just in the middle between both. Such a point is easily marked because here we have the coronal suture that's crossed by the superior temporal line. Such a point here is called Stephanion. Stephanion. Stephan is a name that means a king. Stephanion. Just below the posterior, so the zygomatic process has two roots, posterior and anterior. Just below the posterior root is the tympanic part of the temporal bone with its external acoustic meatus. Is to do with the outer ear. Behind it is the mastoid part of the temporal bone. And such a point here is just the asterion. On the lateral aspect of the skull, we can easily see the structure of the mandible. So the mandible here consists of its body. So the body is limited through an arbitrary line passing vertically behind the third molar, just here. So here is a boundary between the body and its ramus. Some think that the boundary is here. It's wrong. Such a place here is called the mandibular angle or gonial angle, because such a point, craniometric point, is called gonion. Gonial angle means mandibular angle. It completely belongs to the ramus of mandible. Ramus of mandible. The ramus of mandible bears two processes. The anterior one is triangular and called coronoid process. And the posterior process is much more important because it bears the head of mandible. As usual, the head is anteverted by some 30 degrees, like the humeral head, the femoral head, and the mandibular head are all anteverted. between two processes, we can see the mandibular notch. This is just a gateway for neurovascular structure. The exterior of the mandibular angle is roughened by the masseteric tuberosity. Masseteric because here inserts the masseter muscle. Here you can see the anterior border of the mandibular ramus that's continuous, that passes here below the mental foramen to end in the mental tubercle. The angle of mandible is pogonium. Is such a point is pogonium, and the very anterior is gonium, and the very anterior point on the mandibular body, just here, is pogonium. Gonium is behind, and pogonium is in front. So the lateral aspect is difficult enough. And here we can see the coronal suture and the posterior border of the zygomatic process of frontal bone that forms the temporal line that soon divides into the superior temporal line that fades away posteriorly and the inferior temporal line that becomes stronger in the posterior direction and continues with the supramastoid crest and then the zygomatic arch. And here is the zygomatic, the mastoid part of temporal bone, tympanic part with external acoustic meatus. Here is visible ramus of mandible with its coronoid process and condylar process bearing the head of mandible. The head of mandible articulates with the mandibular fossa. The mandibular fossa refers to the squamous part of temporal bone. So temporal bone is above and mandible below, because the only paired joint in the skull is the temporomandibular joint. The ramus of mandible, mandibular notch, such roughenings are called masseteric tuberosity. Just here is gonial angle, and here pogonium. Oblique line passing below the mental foramen towards the mental tubercle. And just here you can see such a crest passing on the maxilla from it's rather passes from the first molar tooth, because the greatest forces are exerted here and then are transmitted posteriorly to the cranial base and superiorly to the cranial roof. such a bone visible here is the temporal surface of greater wing of sphenoid. The greater wing has as many as 5 different surfaces. One of them is visible here. It's called the temporal surface. It just reflexes at right angle and passes in the horizontal plane, and the latter is called the infratemporal surface. So the temporal surface is nearly sagittal. The infratemporal surface is nearly horizontal. Between both is a very conspicuous infratemporal crest. Infratemporal crest. And the norma basalis refers to the external cranial base. It is the most difficult surface of the skull because it's very rough. It contains numerous foramina for neurovascular structures. And the biggest foramen in the whole skull is the foramen magnum. It completely refers to the occipital bone alone. So it's limited in front, and the foramen magnum is the main criterion for separating the occipital bone into 4 parts. In front of the foramen magnum is the basilar part of occipital bone. On both sides of the foramen magnum, we have 2 lateral parts of occipital bone, and posteriorly to it is the occipital squama. And on the occipital squama, on its exterior, we can see the external occipital protuberance with its inion, external occipital crest with inferior nuchal lines. The very anterior point of the foramen magnum in the middle is called basion, and the posterior point is called opistion. Opistion in Greek means like inion, means posterior. So which structure passes between the opistion and the inion? External occipital protuberance, external occipital crest, and external occipital protuberance. The lateral parts of the occipital bone bear ellipsoidal articular surfaces for the atlas. These 2 are occipital condyles. The occipital condyles somewhat overlap the foramen magnum. Because of this, the foramen magnum its transverse diameter is smaller in front than behind, because 2 occipital condyles overlap it in front. Just behind occipital condyles, we have some pits, condylar fossae, condylar fossa, two condylar fossae with condylar canals that enter the cranial cavity. It's invisible here, but the condylar process, but the lateral part of the occipital bone is perforated transversely through the hypoglossal canal. The hypoglossal canal transmits the hypoglossal nerve. This is the last 12th cranial nerve. On the basilar part of the occipital bone, we can see just the pharyngeal tubercle for a frog, pharyngeal tubercle, and sometimes in the front is a small pharyngeal fossula, which is inconstant, and the pharyngeal tubercle is constant. Just between the basilar part, instead of basilar part of occipital bone, we can say the basi-occipital bone. So the basi-occipital bone joins the posterior aspect of sphenoid's body. And just here, between both, is the most important synchondrosis. Synchondrosis, a kind of cartilage between the basilar part of occipital bone and the sphenoid's body. It's responsible for the development of the skull because it functions like a plate of growth in long bones. So due to the spheno-occipital synchondrosis, the whole cranium may develop normally. This is the very last synchondrosis to be closed. It closes late as at year 1825. So such a synchondrosis is the most important synchondrosis in the skull. Just here, you can see in green, you can see the sphenoid bone with its greater wing that expose its two surfaces, the sagittal temporal surface and the horizontal infratemporal surface, separated by the infratemporal crest. So apart from this, we can see two pterygoid processes, the medial pterygoid plate and its lateral pterygoid plate that form on their posterior aspects a depression called the pterygoid fossa. Such a depression is completed in front by the pyramidal process of palatine bone. So, which parts of the sphenoid bone are visible on its norma basalis So 2 out of 5 surfaces of the greater wing and 2 pterygoid processes. We cannot see here lesser wings. Apart from this, posteriorly, we can see a very small area referring to the underside of the sphenoid's body, because to the inferior surface of the sphenoid body, the Vommerian alae are applied. Such a bone here is the vomer, Vommerian alae are applied, contact the underside of the sphenoid bone, sphenoid body. And just between the sphenoid bone in front and the occipital bone behind, the temporal bone is interposed. On the inferior surface of the skull, we can see its squamous part. The squamous part of the temporal bone is present not only on its lateral surface, but it's present on its inferior surface as well. It forms here the anterior root of the zygomatic process, and the mandibular fossa, which is a glenoid fossa, a socket for the mandibular head. Apart from this, in front of the articular tubercle is a small triangular area of the temporal squama that contributes to the superior wall of the infratemporal fossa. So you should remember that the temporal squama is present on both lateral and inferior aspects of the skull. All these things refers to the squamous part, and here tympanic part and mastoid part of the temporal bone. And the most difficult part of the temporal bone is its petrous part. Petrous means rocky, petrous part, or a pyramid, because the petrous part of the temporal bone, we can say petrous temporal bone instead of petrous part of the temporal bone. So the petrous temporal bone is a pyramid that has fallen down and rests on its inferior surface. Two opposite surfaces, anterior and posterior, are inside the cranial cavity. So on the external cranial base, we have only one surface of the temporal pyramid, but it's very difficult enough. Its apex does not reach the junction between the basilar part of occipital bone and the sphenoid's body, the so-called spheno-occipital synchondrosis. And such a place normally in a living person is filled with a cartilage, but in a macerated skull, it presents an irregular foramen lacerum. Lacerum means turn. To lacerate means to tear. Foramen lacerum. So the foramen lacerum is lateral to the basilar part of occipital bone and posterior to the pyramidal, to the root of pterygoid process. Just in the middle of the petrous temporal bone, we can see the opening, the external opening of the carotid canal, because here starts a canal that transmits the internal carotid artery into the cranial cavity. So the external opening of the carotid canal is called the external carotid foramen. Its other ending is inside the middle cranial fossa and inside the cranial cavity. Just behind and somewhat laterally to it is the jugular fossa. The jugular fossa is a big depression because of the superior bulb swelling of the internal jugular vein. Because you should know that between the lateral part of the occipital bone and the posterior border of the temporal pyramid is a big foramen. It's invisible here because the lateral part of occipital bone overlaps the petrous part. Normally here is a big foramen, jugular foramen, as with its smaller medial part and bigger lateral part. And the bigger lateral part is just behind the jugular fossa. The lateral part of jugular fossa transmits the beginning of the internal jugular vein that dramatically expands here to form the jugular fossa. Just between the external carotid foramen and the jugular fossa is an osseous bridge that bifurcates. At the place of its bifurcation is a very small foramen, but very important. That's called the fossula petrosa. It's entered by the tympanic nerve, the fossula petrosa. Even medial to it is just an infundibular opening that's called external opening of cochlear canaliculus. It's to do with the inner ear. So we have here three extremely important structures: external carotid foramen, jugular fossa, external opening of cochlear canaliculus and just... Panie profesorze, ja mam wykład. Jak skończę wykład, to ja się odezwie. No, dobra, dobra. And just between both, among three, these structures is the fossula petrosa. Laterally to these structures is the styloid process, a big process for three muscles, skeletal muscles, and two strong ligaments, because it's called all structures that start with the styloid process are known as Raylan's bunch with red and white roses. 3 red roses refer to 3 skeletal muscles, and 2 white roses refer to 2 ligaments. The former are red in color, and the latter are white. Laterally to the styloid process and medially to the mastoid process is just the stylomastoid foramen, which is exited by the facial nerves. So stylomastoid foramen is on the way between the styloid and mastoid processes. Just the mastoid process is notched medially by the mastoid notch, and more medially in parallel is the sulcus for occipital artery. Sulcus for occipital artery. Just between the greater wing and the petrous temporal bone is a groove on both bones for the pharyngotympanic tube or auditory tube, its cartilaginous part, or eustachian tube. So sulcus for auditory tube refers to both the anterior border of the petrous temporal bone and the posterior border of the greater wing. And in the greater wing, we have 2 very important foramina. The bigger oval foramen ovale and the much smaller foramen spinosum. Both refer to the greater wing. Apart from this, the greater wing has one more foramen that's called the foramen rotundum, but it's invisible from the inferior perspective. It's visible while viewing superiorly from above. If we are looking at the internal cranial base, we can see all 3 foramina within the greater wing. So these 2 foramina, foramen ovale and foramen spinosum, are exposed externally, whereas the invisible foramen rotundum is implicit, is hidden inside the pterygopalatine fossa. Is such Is such a nomenclature very popular in everyday life or not? It's not very popular in everyday life, different Christi or processes. So here we have a real skull, and here is foramen lacerum. So the foramen lacerum is normally filled with cartilage, so it's absent. Oh, here is visible that between petrous temporal bone and lateral part of occipital bone is a big space. That's called big foramen. That's called just the jugular foramen. And just here you can see in front of the pyramid, we can see sulcus for auditory tube that's present on both the greater wing and petrous temporal bone. Which foramina are present in the greater wing that can be seen from below? The foramen ovale and foramen spinosum. The foramen rotundum is invisible. Here is visible the vomer. The vomer forms the inferior posterior part of the bony nasal septum. Among others, it separates two nasal cavities from each other. And just here, we can see two openings leading from the nasal cavity to the nasal part of the pharynx. These openings are called just choanae, one choana, two choanae. This is like posterior nostrils, but we cannot use nostrils. Nostrils refers to anterior openings of the nasal cavity that do not refer to bones. They refer to soft structures. Nostril or nares are limited by soft structures, and choanae are limited by bones. Here is visible the pterygoid process with its smaller medial plate and bigger lateral plate. And the anterior part of the external cranial base is easy because it's composed of the hard palate. The hard palate that's composed in front, some 75% of it is composed of two palatine processes of the maxilla, and the posterior 1/4 is composed of the horizontal plate of the palatine bone. Just in the middle of the hard palate, we can see a median palatine suture, which is the most typical plain suture. So we have, this is not to do with dentate borders. two borders are flat and contact each other. This is a plane suture. And transverse palatine suture between the two palatine processes of the maxilla and two palatine processes, two horizontal plates of the palatine bone. Posteriorly, the hard palate is expanded to form the posterior nasal spine, and the posterior border of the hard palate is just concave. In this area, we have three craniometric points. The top of the posterior nasal spine strictly refers to the PNS, posterior nasal spine. Here we have two concavities with their tops. If we join them through a transverse line, it crosses the midline just here. Such a point here is called staphylon. Staphylos means palate in Greek. Staphylon. Staphylon is in the middle and joins two extreme concavities of two posterior borders of the hard palate. And the third point is alveolon, alveolar process of the maxilla, and its posterior border is here, posterior border of the alveolar process. If we join them by a transverse line, so here we'll be having alveolon. So from anterior to posterior in the vicinity, we have 3 points: alveolon, staphylon, and PNS. In front, the middle palatine suture starts with the incisive fossa. Incisive fossa. On its floor, we have two foramina, incisive foramina, leading to the nasal cavity on both sides of the nasal septum. And posteriorly, we can see a big foramen on either side. It's called the greater palatine foramen. It does not refer to the horizontal plate of palatine bone. It refers to its pyramidal process. Pyramidal process of palatine bone has one in front, one big greater palatine foramen, and behind it 2 or 3 lesser palatine foramina. Have you fed up with today's skull?
No, Professor, it was very interesting.
So, how much time do you have today?
They said that we have until.
Can we finish now?
Yes, it's fine.
Yes. So we'll be continuing on Monday. Yes, on Monday. So no lecture tomorrow.
Thank you.
Thanks. See you on Monday.
Thank you.
See you, Professor. Thank you.
Thank you.
Thank you.